What do Tiger Woods, Kobe Bryant, Rafael Nadal, Heinz Ward, Maria Sharapova, and Stephen Curry all have in common? It has been reported that all of them have had platelet-rich plasma or PRP injections to heal from their sports injuries. And this is just a short list of the many sports stars who have benefited from PRP. In this video, we will be discussing PRP and how it works to heal tendon damage. So what is PRP? As I mentioned before, PRP stands for platelet-rich plasma. PRP is a regenerative medical procedure that uses the patient's own blood to heal injured tissues. It has become increasingly popular in recent years due to its effectiveness in treating musculoskeletal injuries, including tendon damage. Platelets are small blood cells that play a crucial role in wound healing and tissue repair. When a tissue is injured, platelets are the first to arrive at the site of injury. They contain alpha granules, which can release various growth factors, including fibroblast growth factor, or FGF, vascular endothelial growth factor, or VEGF, hepatocyte growth factor, HGF, platelet-derived growth factor, or PDGF, and other cytokines which promote healing and regeneration of the damaged tissue. FGF and VEGF are growth factors that are important in the process of angiogenesis, the formation of new blood supply. These growth factors stimulate the growth of new blood vessels which deliver oxygen and nutrients to the injured area, promoting healing and regeneration. These are very inflammatory effects and explain why injuries involve redness and swelling. Platelet-derived growth factor, or PDGF, also stimulates circulation. In addition, it causes fibroblasts to multiply at the injury site. Hepatocyte growth factor is interesting. Although most of the cytokines we talked about promote inflammation, which is the first stage of healing, HGF has actually been shown to decrease certain molecules that are involved in inflammation. I mention this because platelets and PRP help to orchestrate an incredibly elegant and complicated series of steps, some of which are pro-inflammatory and others that are anti-inflammatory. It is these orderly steps that cause the body to heal damaged tissues like tendon and the lining of joints. Now, normally, when you are injured, your platelets come to the site of the injury and release their healing factors, initiating a cascade of events that ultimately leads to full healing of the damage. Unfortunately, as our bodies begin to age, we lose the normal blood supply to certain areas as seen in tennis or golfer's elbow, rotator cuff or bicep tendinopathy, or Achilles tendinopathy. As a result of the weakening blood supply, tendon damage can accumulate and become chronic. So, how can we wake up or jumpstart the stalled healing process? That's where PRP can be helpful. Here's how it works. The PRP procedure involves drawing a small amount of the patient's blood and processing it in a centrifuge machine to separate the platelets from other blood components. The concentrated platelets, which are now enriched with healing factors, are then injected into the damaged area of the tendon or ligament. PRP therapy offers several benefits over traditional treatments for tendon injuries. It is a safe procedure because it uses the patient's own blood, eliminating the risk of an adverse reaction or infection. Additionally, PRP injections stimulate natural healing processes, leading to faster and more complete recovery. Other treatments like cortisone injections may give short-term relief, but long-term, they may make the problem worse. PRP has been studied extensively and compared to various other treatments, including cortisone injections and surgery. It has been shown in most studies to be both safe and effective. See the links below for some summary reports on the latest scientific studies on PRP use in elbow and shoulder conditions. If you are suffering from chronic shoulder or elbow pain and you are in the Orange County area, please call us to set up your evaluation. Use code PAINFREE23 when you call, and we will examine you and perform an ultrasound evaluation of the painful area for $75. This is normally a $250 value when billed through insurance. Also, if you qualify for PRP treatment, we will apply this to your PRP injection. Thanks for watching, and we hope to see you soon.